Hi, my name is Isaac McBride. Today I'll be doing my capstone presentation on workplace violence in nursing. The aim of this presentation is to highlight the aspect of nursing violence in the workplace. Since it is quoted as leading cause of frustration to nurses and consequently develops a devastating effect to nursing turnover and shortage, as quoted by Magnivitia and Eponymia, 2014. To increase retaining more nurses within the line of work and improve fulfillment, healthcare establishments need to sustain a non-toxic atmosphere where healthcare providers can offer quality care to patients. Research studies concerning workplace violence has been exciting for more than 30 years, but few studies on how to deal with workplace violence conditions has been conducted. The necessity for nurses is ever growing since more nurses are approaching retirement. In order to avert the persistent lack of nurses in healthcare organizations or hospitals, it is vital to guide and nurture nurses within the nursing profession so that they are able to care for our individuals who require and seek health care. Workplace violence among nurses is mentioned as the leading cause of frustration, particularly among new nurses. Normally, frustration at work results to high turnover at the administrative level and results to nurses' distress, whereby others opt out or quit the profession. Horizontal violence is a word used to explain or describe intergroup hostility. Horizontal violence is negative treatment or behavior between group members or individuals. However, the term is sustainable in regards to lateral violence. This is to say, horizontal violence is articulate as harassment, which that can be psychologically harmful and comprises of intimidation, verbal abuse, threats, excessive criticism, humiliation, denial of access to opportunities, exclusion, discouragement, disinterest, as well as withholding of information between individuals or groups of people. The target audience for this paper are the new nurses and top-level management. Of the years, nurses have been exposed to physical and verbal attacks from physicians and colleagues alike. In this case, workplace violence has been a continuing progression and has rendered many nurses confounded as to the reason for its occurrence, and many are not prepared to deal with conflict. A number of researches has shown and indicated that physical and verbal abuse and the intention of nurses to quit the organization are substantially related to this. Also, new nurses are leading the victims of exploitation from other co-workers and are the least studied nursing population with respect to violence in the workplace. Many studies have shown and shared sentiments in the interpersonal and communication conflicts, whereby violence between supervisors and medical staff were the most worrying. Verbal abuse and violence may be considerably costly to the organization as well as to the patient and the nurse. Nurse-to-nurse oral violence has a particularly debilitating effect on the nurse, including her job, and on his or her satisfaction, including the general sense of well-being at the workplace. In conclusion, the hypothetical framework for experienced and new nurses for the educational program on describing identification and approaches for eradication of workplace violence in the theory of empowerment, in essence, central points of the empowerment or enabling theory are defined as controlled and participation for organizations and individuals. In addition, the empowerment theory integrates an active approach towards life issues, awareness of control, as well as a critical consideration of the socio-political situation for purposes of accomplishment and achieving goals. Fruitful control and mastery over circumstances and stressful situations can start to take place at the individual level, since such a strategy has the potential of affecting both the community and organization. Nonetheless, it is worth to remark that community and organizational enablement is not merely attained by having an assemblage of empowered persons, but through the different ranks of analysis. Thank you. What you have in front of you is a brochure created that touches base on essential facts to know about workplace violence. The prevalence of workplace violence has risen 4 times more in the United States healthcare industry compared to that private sectors in the period between 2002 through 2013. Patients and customers caused 75% of aggravated assaults and 93% of all assaults against healthcare workers in 2014. At least 25% of registered nurses and nursing students have encountered physical assault at work from a patient or a family member of the patient in 2016. Workplace violence is nursing constitutes any form of physical assault, verbal abuse, or threatening behavior directed at the nurse in the work setting. Approximately 13% of days persons in the healthcare and the social assistance sector spent away from work in 2013 were due to workplace violence. There are strategies to prevent workplace violence against nursing. Identify violent risk factors, such as risk factors influence the likelihood of assault on nurses at the workplace. Some include individual staff behaviors such as preferring to work alone with a patient and workplace environmental flaws such as poor lighting and design of the unit. Other malfunctions in the organization resulting in poor communication, lack of management commitment, lack of staff, training, and inadequate staffing. Workplace prevention programs nurses need to be involved in any form of program aimed at reducing violence in the workplace. Therefore, nurses have the responsibility to familiarize with the violence prevention programs and policy for the workplace. Moreover, nurses should ensure that they participate in personal safety training programs available by their healthcare organization. Nurses are advised to alert the relevant authorities about any concerning incidents that are suggest violence that recognize procedures for reporting. This brochure also has other areas that touch base on workplace violence in nursing, like familiarization with patient behaviors, being aware of personal responsibilities. For more information, please visit the American Nurses Association. And if you have any questions, please reach me at mcbrij@students.fscj.edu. Thank you.